Here's my best dosage calculation tip for nursing students. Don't use formula method. Now, if you're already using formula method and you're all like, hey, Nicole, it works for me, why are you watching this? Don't fix what's not broken. But if you're still watching this, I'm guessing it's because you don't like math and you're not feeling confident with the formula method for dosage calculations. And for any nursing student or soon-to-be nursing student who uses ratio and proportion to solve dosage calculations, why are you watching this still? Because if you're using ratio and proportion, you're probably already pretty comfortable with math. You're doing fine. Again, don't fix what ain't broke. But if you're still watching, that means you probably don't feel 100% confident with dosage calculations yet. So this is what I recommend. You'll want to use dimensional analysis because even though it can be tempting to start with formula method when you're not comfortable with math, formula method usually falls apart when you start to get to the more advanced dosage calculation types. It can also be confusing because if there's extra numbers that you need in the problem, it's hard to decide which ones to use and which ones to ignore. And if you have to do conversions, then you have to do multiple steps. If you don't like math, multiple steps is obviously not a fun thing to do. But I also understand that a lot of nursing students have a form of PTSD about dimensional analysis because you've tried to learn it before, possibly in chemistry, and it did not go well. You didn't understand it. It was worse. It felt worse than formula method. That is because you did not learn dimensional analysis from me. I'm just saying. I've been a professional nursing tutor for over 15 years, and so that's why I developed a way of teaching dimensional analysis that's very specific to dosage calculations. There's other ways, obviously, to learn dimensional analysis. I happen to be partial to my way because I just teach you 2 rules to follow. You just have to follow those 2 rules, and you're not going to get the question wrong. I show you exactly how to pick out the most important information to plug into your dosage calculation problem, and you can do it all in one step, so you don't have to convert the weight or anything like that before you start. It all gets just plugged in. It's like auto magic. And then once everything's set up in the problem, it's not even the math that's the problem with dimensional analysis. It's the setup. It becomes a puzzle, though, when you follow my rules. Because then once you get to the math, you literally just have to multiply across the top, multiply across the bottom, and then divide 2 numbers. And I know that you can do that much math. Not only that, but now is the perfect time to start dosage calculations, because the other biggest problem I see is that people who don't like math tend to be math avoidant because of the math anxiety. You avoid math, which means you don't practice. And then you get to your required dosage calculations exam and you have to cram, and it's really stressful because it really is a high stakes test, because if you don't pass, you can't proceed in nursing school. So if anybody wants to learn dimensional analysis from me for dosage calculations specifically, 2 ways you can do that. I have a live tutoring membership and I have a self-study course just for dosage calculations. The live tutoring membership, obviously you have access to me. You can ask me questions. We do weekly live group tutoring sessions. There's a forum where you can post to ask me questions. And I will give you the exact practice plan to follow between now and when you have to take your dosage calculation exam. All my links are in my profile, or feel free to leave a comment asking me questions.